Okay, now let's go through renal physiology MCQs, and this is section 2 of this video series. Make sure you also watch the first part of these multiple choice questions. So in this section, we're going to start from question 11. So question 11 reads, the brush borders of the luminal membrane is most extensive in cells of the A, proximal convoluted tube, B, loop of Henle, C, distal convoluted tubule, and D, collecting duct. So in which tubule or section of the nephron are brush borders found or most extensive? So the correct answer for question 11 is A. In the proximal convoluted tubule, that's where you find brush borders. Okay, so we have the glomerulus there. And then from the glomerulus, the first tubule is called the proximal convoluted tubule. So in this proximal convoluted tubule, this is where you find most extensive brush borders. So these brush borders are simply microvilli, okay, finger-like structures on the surface of the proximal convoluted tubule. So that's where you find brush borders. That's where they are most extensive. And in other tubules like the distal convoluted, the ascending or descending tubules, the surface is, they do not have extensive brush borders. So the correct answer for question 11 is PCT, which is A. Question 12. Which of the following increases renal cortical blood flow? Which of the following increases renal cortical blood flow? A, prostaglandins 2, B, norepinephrine, C, angiotensin 2, and D, vasopressin. So which of these choices here increases renal cortical blood flow? So the correct answer for question 12 is A. Prostaglandin is a dilator. It dilates the vessels. It will dilate the afferent and the efferent, thereby increasing the blood flow. Whereas norepinephrine, this one is going to vasoconstrict, and it's going to reduce the blood flow, as well as the angiotensin, which also vasoconstrict the efferent arterial. Vasopressin, this one is also a constrictor, so they are going to reduce the diameter of the blood vessels, thereby reducing the blood flow. But for prostaglandin here, it increases the renal cortical blood flow by dilating blood vessels. So the correct answer for question 12 is A. Question 13. In the kidneys, type 1 medullary interstitial cells secrete A, renin, B, prostaglandin 2, C, aquaporin, D, aldosterone. So which one among these is secreted by type 1 medullary interstitial? So renin is secreted by the juxtaglomerular cells, which are also called granular cells. Okay, so renin is not produced by type 1 medullary interstitial cells. Aldosterone is also not produced by these guys. Aldosterone, mostly it is produced by the adrenal gland, by the zona glomerulosa. The zona glomerulosa cells produces aldosterone in the adrenal cortex. The aquaporin, these ones are mostly found, aquaporins are found in the proximal convoluted tubule, and are also there in the distal convoluted tubule, especially in the principal, and in the collecting duct. So what happens is that the AGH, vasopressin, it's going to stimulate those cells to do what? To express the aquaporins there in the collecting duct, and also in the late distal convoluted tubule. Okay, So the type 1 medullary interstitial cells, what they do, they secrete prostaglandins. So the correct answer for question 13 is B. We move on to question 14. The para-aminohippuric acid clearance of a 56-year-old male with sustained alleviations of blood urea nitrogen, creatinine, and potassium was estimated to be 100 mL per minute. His PCV is 20. Assuming renal extraction of para-aminohippuric acid to be complete, his renal blood flow is approximately A. 25 mL per minute, B. 125 mL per minute, C. 250 mL per minute, and G. 600 mL per minute. So for us to calculate the renal blood flow, there is a formula that we should use. Okay, there is a formula that is used. And now in this question, what we should understand is the para-aminohippuric acid, its function. What is it there for? So this para-aminohippuric acid is simply a marker. It is used to measure the renal plasma flow, so the amount of plasma that is flowing in the glomerulus in per minute. So that's what that thing is used. That's the most important thing in this question. And then from there, we also need PVC, okay, which is 20, and our PAH, which is para-aminohippuric acid, is 100. So to calculate the renal blood flow, the formula is renal blood flow is equals to renal plasma flow over 1 minus PCV. Okay, so here you can also use 100. Okay, if at all the PCV is in decimal number, so like if it is 0.2, you can use this one, but if it is in percentage, you can use 100. So this is the formula to calculate the renal blood flow. So our RPF is simply renal plasma flow. Our renal plasma flow, we use the clearance of para-aminohippuric acid. This one is used to measure the renal plasma flow. So in this case, they are saying it is 100 mL per minute. So our numerator here is 100. So we are going to have 100 over 1 minus. Okay, so PVC, it's 20. So this is in percentage, it is 20%. So if you convert it to a decimal number, it will be 0.2. So we're going to use 0.2 down here. Okay, so here we are going to use 0.2. So if you want this on your calculator, what you should find is 125 mL per minute. So the correct answer here is B. So for question 14, the correct answer is B if you do that calculation. Okay, so remember here you can use 100, and then here you just get the same percentage as 20%, and you still get the same answer. So the renal plasma flow for this 50-year-old male is 125 mL per minute. Okay, that is the renal blood flow. Okay, now let's move on to question 15. Question 15 reads, the renal plasma flow of a patient was to be estimated through the measurement of para-aminohippuric acid clearance. The technician observed the procedures correctly, but due to an error in weighing and advertently used thrice the recommended dose of PAH. The renal plasma flow estimated thus is likely to be A. Forcefully high, B, forcefully low, C, high or low depending on GFR, which is glomerular filtration rate, and D, correct and is unaffected by the overdose of PAH. So this question, what it's saying is that there is this technician who wanted to determine the renal plasma flow. Now what he did, he used the para-aminohippuric acid, okay, and there was a mistake, which is an error which he made. This error was to do what? To overdose. He injected an overdose of PAH into the bloodstream of the patient. So it was 3 times more than normal. So what will happen to the estimate of RPF in this case? So what will happen is that this overdose is going to saturate the channels for PAH in the membrane. So meaning the channels for para-aminohippuric acid is going to be saturated. Now, as a result, what will happen is that the estimate will be forcefully low. All the channels will be saturated, so meaning the PAH which is going to be filtered will be low. So the estimate here of our renal plasma flow is going to be forcefully low. Why? Because the channels for PAH are going to be saturated by that overdose. Okay, so the correct answer for question 15 is B. Question 16. If the glomerular capillary hydrostatic pressure, osmotic pressure of plasma proteins, hydrostatic pressure in the Bowman's space, and oncotic pressure in the interstitium are respectively 40, 25, 5, and 0 millimeter mercury respectively, what is the net pressure driving filtration of fluid into the Bowman's space? A, 10 millimeter of mercury, B, 15 millimeter of mercury, C, 20 millimeter of mercury, and D, 25 millimeter of mercury. So here they're asking us to calculate the net pressure driving filtration, the pressure that is driving our filtrates, the pressure that is driving the fluids or the plasma to be filtrated into the Bowman's space, that pressure. So how can we calculate that pressure? We have been given the capillary hydrostatic pressure of 40, and then from there we have been given the osmotic pressure of plasma proteins to be 25, and also have hydrostatic pressure in the Bowman's space of 5, and the oncotic pressure in the interstitium is 0. Why? Because proteins mostly are not filtered. So how can we calculate the net pressure driving filtration? So this is the formula you use to calculate the net filtration pressure. So what you do is simply add the glomerular hydrostatic pressure with our Bowman's capsule oncotic pressure, and then you subtract that to our glomerular capillary oncotic pressure plus Bowman's capsule hydrostatic pressure. So what is happening here is that you add all the forces which are driving our filtrates into the Bowman's capsule, and then from there you subtract these forces by the opposing forces, the forces which are driving our filtrates to go back in the bloodstream, these forces here. Then what you are going to get will be your net filtration pressure. Okay, so in our case here we have been given the force which is driving our filtrate into the Bowman's capsule, which is mostly our glomerular hydrostatic pressure of 40, that 40 there, and then from there our Bowman's capsule oncotic pressure. This pressure is exerted by the proteins in the Bowman's capsule, but in this case our Bowman's space has 0. The oncotic pressure in the Bowman's space is 0. Why in the Bowman's space we do not have proteins there, so it will be plus 0 here, and then minus, okay, minus, we subtract the pressures which are pushing our filtrate back into the bloodstream. So in this case we have the oncotic pressure in the capillaries. The proteins in the capillaries would want to pull water back into the capillaries, so that pressure here, it is 25. The osmotic pressure of plasma proteins it is 25 in this case. You add it to the Bowman's capsule hydrostatic pressure. So as we filter our filtrates here, that liquid, as it accumulates in this space here, it is all going to exert a pressure back into that capillary there. That pressure is called the Bowman's capsule hydrostatic pressure. So it is an opposing pressure to our net filtration pressure, to our hydrostatic pressure in the glomerulus. So that pressure here we have been given to be 5. Okay, so hydrostatic pressure in the Bowman's space is 5 there in our question. So we're going to add 5 to this. So 40 plus 0, it will be 40, then minus 25 plus 5, which is 30. So 40 minus 30, it is 10 millimeter of mercury. So that will be our net filtration pressure. So the answer here is 10 for question 16. So question 17. Now, an experimental animal with acute induced bilateral obstruction of ureters, glomerular filtration rate declines within 30 minutes of ligation of ureters, primarily due to A, increase in filtration fraction, B, increase in renal plasma flow, C, increase in hydrostatic pressure in Bowman's space, and D, decrease in glomerular capillary permeability. So this question is asking us to know the effect of obstructing the ureters. Okay, so this was in an animal with acute induced bilateral obstruction of ureters. So we have this animal with the kidney, and then from there we have the ureters here. So what they did, they blocked something in the ureter there. Now what happens? So if you block here, the urine is going to accumulate here, and then from there here they can't go, the urine can't be conducted to the ureters. So what happens is that there will be accumulation of urine which will tend to go back. So as urine goes back there, what happens? It will push, and then it will end up into the pyramids. There in the pyramids, you tend to go back in the tubules. Okay, so what is happening really here is that the hydrostatic pressure in the Bowman's space is going to increase. Why here there is a blockage here, so meaning urine won't be excreted. In the end, it will tend to go back to where it is coming from. Okay, so it will increase the hydrostatic pressure here. So meaning our correct answer here, it is C for question 17. Increase in hydrostatic pressure in the Bowman's space. Okay, that's what is going to happen. Our filtration fraction won't increase. Why? Because filtration fraction is equals to GFR, which is glomerular filtration rate, over our renal plasma flow. Okay, so this guy won't be increased. Why? Because this glomerular filtration rate is going to be reduced by the hydrostatic pressure. Okay, so hydrostatic pressure in the Bowman's space is going to reduce that guy on top there. So meaning this will reduce, not increase. Then from there, decrease in glomerular capillary permeability. The permeability will be the same. There won't be an effect in the permeability of the membrane. The membrane is just okay. What is being affected is the ureter. Then increase in hydrostatic pressure. That hydrostatic pressure is going to increase. Increase in renal plasma flow. Renal plasma flow won't be affected there. Okay, so the correct answer for question 17 is C. Question 18. Which of the following substances is cleared the most by the kidneys? A, inulin, B, PAH, and C, creatinine, D, urea. So which one among these is cleared the most by the kidneys? The one which is cleared the most is PAH. It is secreted completely, 100%. Okay, it is secreted by the, it is filtered there at the glomerulus, and then the other percentage which remains is also secreted from the bloodstream into the tubules. Okay, so B is the correct answer. Inulin, some of it remains in the bloodstream, and creatinine also some there is a percentage which remains in the bloodstream. Urea in the collecting duct, it diffuses back into the bloodstream to maintain the interstitium interstitium osmolarity. So the one which is cleared the most by the kidney is para-aminohippuric acid. So B is the correct answer. Question 19. Which of the following substances normally has a clearance ratio of about 1.2? A, inulin, B, creatinine, C, urea, and D, PAH. So question 19, the one which has the clearance ratio of 1.2. So the clearance ratio is simply the ratio of clearance of a substance over the clearance of inulin. So you get the clearance of a substance as your denominator over the clearance of inulin as your denominator, and then you come up with the clearance ratio. So the one with the clearance ratio of 1.2 here, it is B. Creatinine has the clearance ratio of 1.2. Question 20. Which of the following substances has a clearance ratio of close to 1? A, creatinine, B, mannitol, C, urea, D, glucose. So the one which has the clearance ratio which is close to 1 is mannitol. Mannitol has the clearance ratio of close to 1. So thank you so much for watching. Don't forget to like. If at all you like the video, please hit that like icon there, and then from there subscribe to this channel and leave your comment concerning this video in the comment section below.